And I would also observe for you that many who are in the private sector providing goods and services to those healthcare providers, such as hospitals and nursing homes, also suffer because when the state fails to pay its bills in a timely manner, oftentimes that nursing home is saying to that food provider or the person who is giving any other services, you have to wait because we're waiting for the state's check to come in. And then that third party provider, in this case, let's say someone who's delivering food to a nursing home, goes and takes a bank loan to cover the cost, waiting for the payment from the nursing home who's waiting for the payment from the state. So there is quite an effect on health care on the private sector. Lastly, I'd like to speak and mention the fact that we're all taxpayers, and that the taxpayers are the ones who are ultimately being asked to pick up more and more of the cost of health care. And particularly, we're being asked to pick up more and more of the cost of health care as our public officials, particularly elected public officials, try to appeal to the populace, try to appeal to a population to say there is a free lunch, there is a Santa Claus, there is a silver bullet to the problems related to health care. I don't happen to believe that. There is no quick solution. There's no quick fix. There is not a silver bullet answer. And it is not a free lunch, as much as some of our elected officials would like for us to believe. And I say that within the context of our governor saying that we should impose a gross receipts tax on every employer in the state of Illinois, or we should impose a payroll tax on every employer in the state of Illinois in order to achieve billions of dollars, billions of new dollars, to subsidize the cost of a healthcare system that in Illinois at least is not adequately functioning currently. We are not paying our bills on time. We are not paying for the full value of the Medicaid cost that the state bears. And perhaps more importantly, there is almost no incentive for government to be efficient. There is almost no incentive for government to try to control their cost. There is no incentive for government to try to pass on any of the cost to the recipients. There is no incentive for government to try to stress to the beneficiaries of government services that perhaps they should have a healthier lifestyle, that perhaps they should manage their health, that they should perhaps be engaged in an exercise program or a monitoring program or a baseline assessment, health assessment program, all of which the private sector employers are doing increasingly to make sure that their employees, their charges, if I can use that term, are helping to control costs. Yet government, on the other hand, takes a different perspective, which is how many more benefits can I give to my charges so that they will be happier and they will vote for me to be reelected. That is the free lunch concept that I would submit to you is not where we need to be. Now, the Illinois Chamber has been involved with this in part because I believe that our institution is one of the few institutions that has the ability, the reach, the umbrella, if you will, to be able to bring employers and insurers and healthcare providers and opinion leaders and decision makers together to wrestle with these issues in a non-controversial, non-confrontational environment. And that's exactly what we've been trying to do over these last several months. And in part to try to respond to the public appeal that our elected officials are increasingly trying to offer to the public as to what we ought to be doing about the healthcare crisis in our state or in our nation. Now, I would suggest to you that the private sector got on board with this many years ago when they began to recognize that their health care costs were no longer just an incidental aspect of doing business. that healthcare costs have been growing at double-digit pace year after year, and CEOs and private sector business people tend to look at the bottom line. And they tend to say to themselves, okay, this widget is costing me more, this input is costing me more, and what is the single biggest cost that I'm confronting is my employee healthcare cost. What are we going to do about it? And so in the private sector, we have seen some very aggressive action plans across the nation and in some of the major employers in our state to be aggressive about intervention with their own employees in order to help control their costs. And it's a much more visionary approach than I think most are recognizing, and specifically that our government policymakers have not recognized nor embraced, and yet I believe fundamentally should be embracing. We should be talking about value-driven health initiatives. And last year, the Secretary of Health and Human Services, Michael Leavitt, with the blessing of the White House, actually launched a federal program based on what was already going on in the private sector of what we call the Four Cornerstones. And the Four Cornerstones are now being applied to every federal health care program. That is, all federal employees, all federal retirees, people doing business with the federal government and such, but also trying to get employers, private sector employers, to collectively embrace these same four components. And I'm going to read them to you here. Employers expect information about performance and quality of care delivered by healthcare providers that participate in the company plans. In other words, if you want to participate in my company plan, we want to know, we want information about your performance and about the quality of the care that's being delivered. The objective is to provide the employees with information they need to make wise choices. Secondly, employers expect price and cost information from healthcare providers. Those healthcare providers that participate in the company's plans so that employees have information to compare price and quality before making a decision about where to go for health care. Third, employers expect that employees expect their health care providers in company plans to adopt health information technology products and use common standards. Performance and cost reporting cannot occur without the investment in technology and the interoperability of data exchange. What's this mean? What does the private sector do better than anybody else? They measure. And things aren't successful if you don't measure. And so what we're asking from the private sector is for healthcare providers to start giving us information, to measure the information and make it available to our employees, millions of employees who use private sector health insurance, so they'll make better, wiser choices. And fourth, employers must provide incentives to their employees to use the information and to providers for implementing these measures to help achieve high-value health care for patients and therefore their employees.